Hey there, and welcome to another episode of the Active Health Podcast with Dr. Josh Mason, where we discuss all things health, fitness, and performance, and where we believe in taking an active role in your health. Today, I want to discuss a topic that is commonly very frustrating for patients that come into our office. That is that bone on bone or arthritis is not a life sentence, meaning that it's not the end of the story. So many times we have patients that come in either for that particular condition or another condition, and they've been told that they're bone on bone and that there's no really other options for them. And this is very frustrating for the patient and also for us as a provider because they've been told that by a provider, they oftentimes do not seek out other care. They just feel like, oh, I have arthritis or I'm bone on bone. I'm just waiting for that joint replacement or that surgery because there's no other options. And there couldn't be further from the truth. We help patients with both bone on bone and arthritis. And actually, sometimes it's super frustrating that they've been told they're bone on bone when actually reality, they actually have quite a bit of space, which means there's a lot more we can do for them. I'm not sure why this happens and why some providers are quick to jump on and just giving people a life sentence of arthritis and telling them bone on bone and they don't have options. But the truth is if you've been told that, I encourage you to just seek out another provider and get a second opinion, because we see it every day where people have been told that they have arthritis and feel like there's nothing they can do. But let's just educate a little bit on what this could look like and what the degeneration and the arthritis is a process that you go through. And so there is mild, moderate, severe, etc. So let me show you some of this. I'm going to share my screen with you real quick, and I'm going to show you a couple of different things here. So bear with me a second here. All right. So let me pull up this big picture here. First and foremost, you can see we have this scale going from no arthritis at the 0 spot all the way over to severe true bone-on-bone arthritis in number 4. And you can see through the process the things that are starting. This is a knee. So we can see that the joint space is beginning to narrow as we go from stage 1, 2 to 3, obviously all the way to 4. That space between the bones is getting smaller and smaller. We can also see that the structure of the bone and the surfaces of the bone are become more and more irregular with some spurring and things that are going on. Obviously, during this process, that meniscus or cartilage between the two bones is starting to deteriorate, and so we have less and less cushion. So you can imagine that there's more and more pain. Also, they're starting to have much more stiffness in the joint, swelling, lack of range of motion, a lot of host of other problems going on. But again, this is a gradual process that takes time. And just because you have arthritis does not mean there isn't options. Truth be told, in our office, we have options for you the entire time if you're trying to avoid surgery. We have very good options all the way through stage 3. Stage 4 is getting to the point where really your only option might be that joint replacement. But all these other stages, we have great solutions for that. And it is by far from a life sentence of just pain and having to deal with the pain. So you can see that that is a big variation of processes. Again, the frustrating part is when people are told that they're bone on bone and there's no options, they just completely discontinue seeking care. We'll have patients all the time come into our office and they'll be told, there's nothing we can do about your knees. You just got to wait for joint replacement. And so potentially that patient's coming into the office for, say, back pain or something. And we do a comprehensive exam and comprehensive history. So we want to ask them questions. So do you have any other aches and pains? And they'll mention, well, I have this knee pain, but no big deal there. I've been told it's bone on bone. I'm just waiting to get my joint replacement surgery. And it's super frustrating because that's kind of what they've decided is they're just waiting for that when there's so much more we can do. Just this week, I'll share this. I'm going to share my screen again. If we go back to my screen here, this is a screenshot of a patient that she actually did come in for treatment of this knee pain. She actually had just had joint replacement surgery on her other knee, and it was not going well. She was in a lot of pain, the knee that had just been replaced. And it was going so poorly, she really wanted to take a look at this one. And the surgeon had told her, we'll replace this one first, and then we'll get to this knee because they're both bone on bone. As you can see, this knee is in fact arthritic. It has lost some joint space there on the inside of the joint, but you can see there's still a fair amount of space. And what was unique with this patient that really frustrated me is this particular knee, which the surgeon is ready to do joint replacement on. The patient, her pain level was annoying. It wasn't significant. And when examining her, she had full range of motion, meaning she literally could put her heel almost through her butt and she could extend it fully in both directions. A lot of times when the arthritis is so bad and you don't have other options, is your range of motion is vastly reduced. And again, even in those circumstances when the range of motion is vastly reduced, through the rehab, through the injections and things that we do in our office, we can help these conditions without cortisone shots, without horrible medications that just numb the pain, and obviously without that horrible invasive joint replacement surgery. And so the frustrating thing for me and her is she even said she wishes she would have come to us before and got a second opinion, because when presented with her knee pain at an orthopedic office, they told her this is bone on bone, no options, joint replacement's your only option. So she went ahead and did it with one, but because of her horrible experience, she wanted to try something different. And that's what brought her into our office. And she is going to be getting treatment for this knee without the harmful surgery and joint replacement. Conversely, if we even just, you can see this on my screen. If we just put the side by side here of another just screenshot I have, you can see the difference between this is bone on bone. Everyone can see that. In the stage 4 over here, that's bone on bone. But this is not bone on bone. This is probably between stage 2 and stage 3 here, maybe right around stage 3. So there's definitely hope for this patient. And I hope we can help her and make a huge difference. But again, the point of this entire podcast is that bone on bone and arthritis is not a life sentence. You do not have to put up with pain just because you have that. There are more and more options, particularly in our office where we're using PRP, A2M, stem cell injections, pulse wave, laser, lots of different options that are making a huge difference in people's lives and getting their pain back. If you are one of those that are suffering with arthritis, with joint pain, and you've been told there's no hope, that you are just getting a cortisone shot every 3 months and there's no other options, and you're just delaying the inevitable of having a joint replacement surgery, I'm here to tell you that every day we are treating patients that are getting away from that, are getting away from their medications, getting away from the cortisone shots, and getting their life back and regaining their mobility and their ability to function and enjoy life. Whether it's knee pain, hip pain, shoulders, obviously backs is a base of our chiropractic care in the office. We have lots of treatments for even back pain. The combination of the stacking of systems and the stacking of procedures that we have in our office really make outcomes that are unseen anywhere else and give people a ton of options. And so I hope that after hearing some of this information and realizing that your bone on bone or your arthritic condition is not the end of the story, I hope that you consider coming and checking it out, or just getting a second opinion. It doesn't have to be our office, but I encourage you to continue to seek out another provider and get a second opinion. There is so much more that can be done for those joints. You do not have to keep popping pills and keep doing cortisone shots and just delaying the inevitable of some surgery someday. So again, I hope this is informative and helpful for all of you that are struggling with joint pain and knee pain or shoulder, whatever it may be. This is here to provide some hope. I hope that you hear this and we'll take some action so you can enjoy your life. Again, this is Dr. Josh Mason. I hope you're enjoying these episodes and I hope that you find them informative and helpful. If you have any questions, put in the comments below. If you have any recommendations for episodes, please let us know. If you're liking these, please like and share. Hope to see you in the next episode.